Hello, I'm Dr. Brandt R Gibson, and I see patients on a regular basis with foot pain. A lot of times there's no explanation, no reason. They say, okay, I didn't do anything. I just woke up and my foot was hurting, or I stepped down on the ground and my foot starts to really, really hurt. And there's multiple different things that can do that. Some people get plantar fasciitis in the heel and they say, I don't remember doing anything, but when I woke up the next morning and started walking, my heel was killing me. There could be tendonitis, like the posterior tibial tendon injury, where you say, okay, I was doing fine, I wasn't having any real issues, but then the next morning or after sitting down for a period of time, I get significant pain in my arch, and I have it kind of radiates up the ankle. But the one I want to talk to you about today is called metatarsalgia. Basically what it means is pain to the metatarsal. And although I don't have a foot model with me today, you basically, if you were to take a hand and you have the phalanx that makes up the fingers, then you have the carpals, metacarpals, that are in the middle of the hand here. The foot's the same way. Metatarsals will be in the middle of the foot, and the ball of the foot right underneath, right behind the toes. If you say, okay, I got pretty significant pain right there, and I can't find a fracture or a sprain or an injury that can be explain this, or you say, okay, different motion doesn't really do it, it's the pressure on that area. Typically, that's what we would call metatarsalgia. It's basically a pain to the metatarsal head, to the ball of that foot, in such a way that causes pretty significant discomfort and pain. So what is the reason this can happen? There are really three. One is you can sprain the foot. If you sprain the foot in such a way, you can actually get pain right to the ball of the foot, depending on where the sprain is, what ligaments you've injured, and so forth. Number two is bruising of the bones. If you're wearing inappropriate shoes or poor shoes, or you step on something in such a way and you bruise that bone, you're going to get metatarsalgia in that bone area. And the third is just a walking abnormality. You're not walking like you should. You're walking in such a way that it's causing pretty significant discomfort in that area. In this case, that can cause pretty significant pain, pretty significant discomfort, or metatarsalgia in this way, where you got pain right to that ball of that foot. Typically, it's not painful when you're not on it. It's not painful in all shoes. If you're in a pretty good supportive shoe, sometimes it hurts less, but it's pressure to that area that causes pain. Metatarsalgia can be easily treated. The easiest way is to use a metatarsal pad, basically a gel pad or a felt pad that sits behind the metatarsal heads. So when you step down, there's no pressure to that area. That's the easiest way to do that. Going into good shoes, going into custom orthotics or specialized inserts can actually help as well, although the pad is just as easy and usually a lot less expensive. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 334, metatarsalgia, or pain to the